people, did you have a bad dental experience? This is, not awful because you're recognizing that they're uncomfortable, but asking the first thing about their bad dental experience is maybe not the best way to kind of have your first conversation with them. So E is definitely the best. Introducing yourself, saying hello, and then just kind of asking what brings you here today. It's a great open-ended question so that the patient can then tell you in their own words what's going on, and you can kind of start out your relationship on that note. So perfect. You guys crushed it. 3 out of 3, 100% on the boards. Good job. Okay, we'll move on to behavior techniques here. This is kind of jumping to a different thing here. These are kind of complicated. I know you guys have probably learned some of this stuff before. They're a little bit complicated, so let me know if I'm not explaining something great or something like that. But basically, what we're going to talk about is these 3 things are 3 different ways that people learn how to do things. Observational learning is like the most obvious one. So we're not really going to talk about that one in more detail. Basically means you learn by watching somebody else do it. So here we have his dad. He's folding some laundry, and then little kid sees him folding the laundry, and he learns how to do it because he saw his dad do it. He copied him, and now he learned how to do it. Pretty self-explanatory, observational. He observed him doing it, and then he learned how to do it. So that's observational learning. The other 2 we are going to talk about in more detail and kind of talk about how they relate to dentistry. Okay, so classical conditioning. This is the story of Pavlov's dog. I'm sure you guys all know the story, but basically what it is that the scientist Pavlov, he learned that when he would feed his dog food, this is an unconditioned stimulus, his dog would start drooling. So just naturally, based on the dog knowing he's about to get some food, he would start drooling. So he's excited for the food. We know if we start talking about delicious cakes and pies and stuff, you start to like kind of drool and start to get hungry just because you're thinking about the food. However, if you just ring a bell around a dog, just ring, 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 nothing's going to happen. The dog doesn't have a response to that. They're like, okay, whatever, it's a bell, it's annoying. This is a neutral stimulus. So it's neutral because it doesn't stimulate anything to come out of the dog. It just doesn't do anything. But if you combine the 2, the dog is still kind of having this, there's my food, I'm going to drool, but he hears a bell every single time that he sees the food. Eventually, he'll start to associate this bell with food time. So then you can take away the food and only ring the bell, and he will start to salivate. So it's kind of like if you, every time that you hear the lunch bell at school or whatever. Every time you hear the lunch bell, you start to get hungry. It's not because the bell made you hungry. It's because food is about to come. That's this exact same concept. So how that relates to dentistry is, let me get my drawings off of there. Oops. How that relates to dentistry is kind of with the concept of white coat syndrome. So in this case, the food is going to be pain. So, and this is, let's say this is, obviously it's a dog, but this is the patient. Whenever the patient sees pain or experiences pain, their response is fear, right? So this drooling is fear. So pain automatically, that's just how we are as humans from back in the caveman days. If you know you're going to experience pain, you're scared. You don't want that to happen. You're scared because pain's coming. The bell is a white coat. So a doctor, a dentist, anybody. Sorry about this writing, kind of hard to write on here. White coat, normally, if the patient has never ever seen a doctor before, doesn't have any idea what a white coat means, you just see a white coat lying on the street, that should not make any kind of response, right? It's just a white coat. It's just a piece of fabric. It's just a jacket. It's fine. You shouldn't have any kind of response to that. But if, I'm going to abbreviate this as white coat, if every time you go to the doctor, so every time this white coat, every time you go to an office and you see a white coat, you experience something that gives you pain. I don't know why this is writing so weird. So if every time you go to the doctor, so the dentist, the doctor, you have to get a shot, you have to get a filling, you have to get, anything like that, then suddenly the white coat and the pain are just always going to be associated together in your mind. And so then later, when you just see a white coat, so you just walk, the doctor just walks into the room, hasn't even done anything yet, you start to get fear, you start to get increased blood pressure, you start to get, sweating, you start to get increased heart rate, that kind of thing. So that's kind of how this classical conditioning works. There's a stimulus, something that makes you have a response. There's a stimulus that doesn't make you have a response. But when you pair those two stimuli together, eventually that thing that didn't make you have a response before is going to make you have that response because in your mind you associate it with the other. Does that make sense to you guys? Again, I'm sure you all know Pavlov's dog story, but okay, cool. So that's classical conditioning. The next type, excuse me, choking. Water. Okay, sorry. The next one is called operant condition. So this is kind of the concept of if you do something and then that makes something else happen, if it's a good thing that happens, you'll keep doing that thing. If it's something bad happens, you'll stop doing that thing. So I'll explain that a little bit more in detail. So there's 4 different concepts here. Positive reinforcement. So positive reinforcement. That means if you do a good thing, you get a reward. So what is that going to make you do? You're going to keep doing that good thing, right? Because you've got a reward. So every time you do something good, you get a reward. Keep doing that good thing. So you learn to do that good thing. So it's like when you're teaching your dog how to sit, if they sit, they get a treat. So if you say sit, and then they sit and they get a treat, they learn, if I do this, I get a treat after. So I'm going to keep doing it. So that's good behavior, get a prize. You're going to keep doing that good behavior. Negative reinforcement means you do a good thing and then you remove a bad stimulus. So for example, if you brush your teeth, you don't have to get fillings. You don't have to have any pain. So, it's you're going to keep doing that good thing so that you get no pain. So these two are very similar because in both of them are ways to get you to keep doing good behavior. However, you either do good behavior and get a reward or do good behavior and avoid something bad happening. So, for example, it's just even something as innocent as like following traffic laws. If you follow all the traffic laws and you drive and you stop at red lights and you do the right thing, you won't get in a car accident. That is enough reinforcement to make most people drive safely, right? So you drive safely because you know bad things won't happen to you if you do that. So that is negative reinforcement. So both of these two are reinforcing good behavior. Reinforcing good behavior by something positive happens to you, or reinforcing good behavior by something negative not happening to you. So then the next two are punishments. So punishments mean you're not trying to reinforce good behavior, you're trying to stop bad behavior. So in positive punishment, if you do something bad, you get a punishment. So then you're going to learn, I need to stop doing that bad thing. So for example, if you don't behave, you hit your brother or your sister or whatever, you have to clean your room. Most people, that's a punishment for little kids. So if you do something bad, you get a punishment, you're going to be like, okay, I need to not do that bad thing. Okay, I won't hit my brother again because I had to clean my room last time. So you learn to not do the bad thing. Negative punishment is similar in that if you do a bad thing, you remove a good stimulus. You remove something that they want. So don't behave, you hit your brother or sister, you get your phone taken away. You don't get to go to the concert next week. So you're removing something good. So both of these things are going to make sure that you don't do a bad behavior. One by getting punished, one by removing something that you do want. I know this is kind of complicated. Does that make sense to you guys? And we'll do some examples in a second, but does that make sense or should I go over it again? All good so far, maybe? Okay, so we'll do some examples. So kind of dental related example here. If a patient is given a habit breaker device to prevent thumb sucking, this is an example of what?
I think positive reinforcement, right?
Okay, so we are trying to stop them from doing a bad behavior, right? So is that punishment or reinforcement?
This is reinforcement.
So reinforcement is we're trying to encourage. This one I guess I can kind of see how it would be both ways, but this one is going to be positive punishment because if they do this bad thing, if they suck their thumb, they're going to get poked by the habit breaker appliance. I'm sure you guys have seen those. It's like spikes behind the teeth to where if they suck their thumb, they feel this pokey thing behind their teeth. So if they do this bad thing, they're going to get punished. So that is going to be do the bad thing, you get punished. I know it's kind of similar. That one's kind of maybe not like worded very well. I don't know who wrote that question, but I guess I could kind of see how it could be one of these. But basically, you have to look at what the behavior that they're doing is. So thumb sucking is a bad behavior that we want to stop. So that's going to be one of these punishments. And so we're punishing, or the punishment would be something bad happens to them, not something good taken away from them.
Doctor, I was thinking that if he quit this habit, this is a good thing. So I said the positive
Yes,
one.
like I said, that one I could definitely see that one being both ways. I understand that that's how that's. Like I said, I don't know who wrote this, but it's maybe not worded. Maybe I'll come up with a different question and change this slide because that's not worded very well. I could definitely see how you think that not sucking your thumb is a good behavior. So if we're, yeah, I understand how that's confusing. So I'm just going to probably take that question out. But this one's much easier. If you give a child a new toy to reward them for achieving good grades, that's an example of what?
This time is positive, but
Yes, good job.
reinforcement.
This time it's positive reinforcement. That one's much more obvious. I'm going to find a different way to word this question, and I'm going to change that for the next time. I'm pointing out that can be very confusingly worded as our fault. Okay, a couple of slides on kind of fear and like pediatric behavior management. If a young patient, and these are all just kind of like little tidbits that are based on old remembered questions, old questions, stuff that people that have taken integrated boards have come and told us was on the test and stuff like that. If a patient is scared of their first visit to the dentist, it's most likely due to their parents or somebody that's an authority figure, their brother or sister, parents. You're not just born scared of the dentist, right? It's just usually because either their parent or their siblings have kind of worked it up in their mind to where they think it's going to be scary before they even get there. If they are scared the first time you meet them, you should get down to their height and talk to them. We kind of talked about this a little bit earlier. The best way to talk to somebody is to be on the same level as them. And even though they're little kids, they really do respond to you getting down on your knee, talking to them face to face. You seem a lot less scary when you're at their height versus if you're this big, tall person in a white coat that has scary instruments, and talking to them from that level. This concept, I don't really love this concept, but this is what they say on the boards. So they say that fear, if you have fear, that's over one specific thing, whereas anxiety is about like everything. So you have like a fear of needles, a fear of pain, a fear of drilling, a fear of the noise in the dental office. You don't really have anxiety about one specific thing. Usually anxiety is kind of more of like a generalized concept of the whole situation. So if you have anxiety about going to the dentist, that might be because you have a fear of the needle or the pain or something like that. But the anxiety, again, according to them, is a little bit more broad and overarching, whereas the fear is kind of over one specific thing. Again, I'm not sure how much I really love that wording, but that is what they say on the boards. Positioning. So this has to do with how you should position the patient in your office to be kind of the most comfortable for you and the patient. If it's a 0 to a 1-year-old, you should do the knee to knee position. So what that means is that the dentist, let's see if I can draw this. I'm so sorry. I'm like a terrible artist. Let me see if I can kind of draw this. So mom and the dentist, or dad and the dentist, or whoever brought them to the office, are sitting in chairs across from each other like this, with their knees kind of right up against each other. And then let's say this is the dentist and this is the parent. So the baby, or the little 0 to 1-year-old, will sit kind of in the mom's lap to where the head, the baby's head is like right here. There's their mouth and their nose. Oh Lord, sorry, it's a creepy baby. And their body kind of is going this way. And so then they can see mom right here. So it kind of helps them be a little bit less scared in this weird environment. They can see their parent is right there, but then the dentist still has a pretty good view of looking down at the mouth and the teeth, making sure everything looks healthy, making sure, the teeth are normal and developing okay and stuff like that. So that is the knee to knee position. And then the head, the body is pretty much in the parent's lap, and the head kind of then is in the dentist's lap. So they can still see that their comfort is right there. Their mom or their dad's there, but the dentist can still do what they need to do. As far as a 1 to 3-year-old, you kind of can ask the parent what the best way that they think is for the kid, because the parent knows their kid the best, right? So some kids that are 3 years old, they'll run into your office, they hop up in the chair and put their mouth open and just wait for you to do whatever you need to do. And they're great and they're so cooperative. But some that are a little bit more shy or whatever, they might be better off with like being on their mom or dad's lap. So then if the parent is, laying in the chair like this, then the little kid can kind of be on their lap like this. And so then, she has a lot of arms. So then the dentist can still, is sitting here and can still see down into the kid's mouth, but the kid still knows that like their, mom or dad is kind of holding them. So they still feel comfortable. They don't feel as scared. You can even, the dentist can put the mirror and the explorer in the mom's mouth first. So then they're like, see, look, daddy is, look, I could do it to dad and he's totally fine. We're just going to count your teeth. And then you can kind of show them on mom or dad first, and they can see that it's not scary. And then when you do it to them, they're not as scared. So the most common reasons for fear in 1 to 3-year-olds is separation. So that's why the knee to knee position, or a position kind of like this, are really good for them, because the thing that they're most scared of is being separated from their mom or dad. So just having them in the exam room by themselves, they're going to be terrified. They are scared that they're not with their parents. So that's why these kind of positionings are really important, because it helps them not be scared. And then 4 to 6-year-olds are a little bit more afraid of the unknown. So they're not quite as worried that they're not with mom or dad, because they're probably in school. They've had a little bit of separation. They understand that mom and dad are going to come back and they're not just completely abandoned, but they're a little bit afraid of the unknown, because they probably might be doing some stuff at the dentist that they've never done before. And so they're scared of a drill, or they're scared of the smells and the sights and the feeling of somebody poking around their mouth. So they're 4 to 6, their fear is the unknown. 1 to 3, separation. I'm not going to really go over this slide too much, because we are going to run out of time. But a couple of important things when it comes to pediatric dentistry techniques are going to be these ones. So modeling behavior is when you use some kind of role model to show the patient how to behave. So like I said earlier, if they see mom or dad go first, even if the mom and dad aren't there for a dental appointment, if you just kind of pretend on the mom or dad and they see that it's not scary, then they learn that it's not scary. That's that observational learning, right? They see something happening, they see it's not scary, and so then they're not scared to do it. So even if their older sibling goes first, we know little kids are always trying to be exactly like their brother and sister, the big brother and sister. So doing, counting the older sibling's teeth and giving them a sticker, and then the little kid's like, I want to do that. They did it. Desensitization is constantly exposing a patient to something to remove the fear part of it. So an example of this would be, as long as the patient is constantly coming for their frequent dental visits, a little kid, if they come every 6 months, And all you do is count their teeth and give them a high five and give them a sticker, and they get to watch the TV that's on your ceiling, and they get to, choose what flavor toothpaste they want. And it's so cool every time they go to the dentist. If they have multiple positive dental visits, then they kind of get desensitized to that fear that they think that they should have, right? So they're like, every time I go to the dentist, I just get to sing songs and get a something from the treasure box. It's awesome. I love the dentist. They're not scared of it anymore because they've multiple times been there and had a good experience. That's why it's so important to talk to the parents, because if the parents only bring the kid to the dentist every few years when the kid has pain, then the kid, every time they come to the dentist, they have to get a filling and they have to get a shot and they have pain. So that's the opposite of this. That's like, they're definitely going to be scared of the dentist because every time they go, they have pain. So having multiple frequent positive visits is going to help them remove that fear. And then tell, show, do. So we kind of talked about this earlier, where if you can teach something, then you kind of understand it a little bit more, right? So if you can kind of show that you learned what you learned, then you show that you really understood it. So when you're teaching kids how to brush their teeth, the best way to do it is the tell, show, do method. So first you tell them what to do. You say, you want to put a little tiny pea-sized drop of toothpaste on your toothbrush, and you want to get some water on it, and then you want to brush every tooth, and you want to brush it in a circular motion, and blah, 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 whatever wording you want to use for your instructions. So first you tell them. Then you have them hold a mirror, and you have the toothbrush in your hand, and you show them exactly what you mean. Show them, little circular motions, and show them how much toothpaste to use and stuff like that. And then you have them do it. So if they can show you that they can do it, it means that they, understood what you were saying and showing them how to do. So, and then they kind of feel included. They feel like they got to do something for themselves. They feel like independent, stuff like that. So tell, show, do is great for teaching kids stuff. Okay, so moving on again, this PowerPoint's kind of all over the place. Some legal concepts. We talked about this earlier. Child abuse. As dentists, we are mandated reporters. So some signs of child abuse are multiple untreated injuries, lag time between injury and treatment. So maybe the kid says, they broke their arm, but then their mom didn't take them to the hospital for like 2 weeks after that. That is lag time between when the injury happened and when the treatment happened. Comminuted facial fractures. So what that means is that if a kid breaks a bone, like because they fell off their bike or something, they just had one fall and they hit the pavement and they kind of break their bone, it looks like this. And this is a terrible drawing of a bone. But if you break your bone because you fell or something like that, it just kind of breaks like that. But if you break a bone because you got hit a bunch of times, it's going to look like, oh gosh, let's see if I can draw this. It's going to be more like literally just kind of, and again, this would be like like the facial bones or something like that. But it's going to be like a whole bunch of tiny little pieces of bone. Because, if you just like snap a carrot in half, it just snaps in half like that. But if you pound a carrot with a hammer, it's going to pound into a bunch of different pieces like that. And it's going to be a little bit more comminuted, just kind of means it's like, basically like you can't really put this back together. It's just been like hit too many times. So if you see that in a patient's facial bones, that they have all these little bone fragments, it probably means they didn't just get hit with a baseball. It probably means somebody's been hitting them multiple times. And then, like I said earlier, different stories. So if the little kid says that they fell down the stairs, but then the dad says they ran into the wall, and then the mom says they got hit playing sports, different stories is not a good sign of, it means that somebody's trying to cover up something probably. Child abuse is most common in children under 3 because while they're that young, a lot of parents feel that they can't express what's happening to them, so they don't think that they're going to get caught because the kids are too young to properly express and tell somebody what's happening. So if you suspect child abuse, the department that you should call is social services. If you suspect elder abuse, It's the Department of Health and Human Services. So these are actually past boards questions and concepts. Child abuse is social services. Elder abuse is health and human services. Elder abuse is, you know, a lot of times children end up taking care of their elderly parents or grandparents, and they could be physically abused. They can be financially abused because they don't have anybody else to take care of them. So they just kind of, even though they're adults, they are too scared to report it because they don't have anywhere else to go. So that's who you should call if you suspect that. Okay, random, literally random vocabulary. We've gone over a lot of these, but one big one that they love to talk about is euphemism. So a euphemism is when you replace words that are like maybe scary or complicated sounding with nicer words. So like instead of saying, I'm going to give you a shot of anesthesia, you could say, I'm going to put some sleepy juice on your tooth, and your tooth is going to go to sleep and feel really sleepy and really fat. Or if you say, I'm going to, you know, use this, you know, instead of holding up the etch, syringe of etch before you put a etch on the tooth to do a filling, you say, I'm going to put this blue sour candy on your tooth. It's going to be really sour. And because sometimes, you know, a lot of patients, especially pediatric patients, think that the etch is another shot because it kind of looks like one. So if you just tell them, this is some blue goo that I'm going to put on your tooth, it's going to taste really sour. That is called a euphemism. You're kind of making something sound nicer by calling it something else. So I'm not going to go over all these because we kind of have gone over those, and the ones that we didn't, you guys can just read yourselves. Oh, perfect. This is kind of like what I was talking about. 6-year-old male. The parents say he's very afraid of the dentist, but just needs a filling. No medication or med history. He has a class 3 filling needed on tooth. After preparing the filling, the dentist pulls out the etch, and Johan gets very scared. The dentist says, I'm just going to use this blue shampoo to clean the sugar bugs. So what is that concept called? We just talked about this, but I know it's kind of a long word.
Euphemism?
Yes. Very good. Euphemism. Very close. Oh, I thought it was going to pop up on there. Yes, euphemism. I know it's a kind of a weird spelling and long word, but euphemism. Perfect. Good job. Okay, 10-year-old male has a broken front tooth. No medication, no medical history. According to the dad, he tripped and fell earlier that day when he was playing with his brothers. Current findings are the father smells like alcohol and his story is inconsistent. Something doesn't seem right. Who should you call?
Just switch the slide, please.
Oh, is it
on random important vocabulary?
Oh, it is?
Yeah.
Okay, must be frozen. 1 second. Let me make sure there's nothing. Okay. Sorry, I must have got frozen. Okay, how about now? Is that good?
Yeah.
Okay, perfect. So who should we call if we suspect something is not right with the story and this is how the kid presents?
Social service?
Yes, social services, perfect. Social services for child and health and human services for elderly. Good job. And again, I know it seems kind of scary. You don't have to be in the room with this kid and the dad and pick up the phone and call social services. You can go back to your office, call in private. You know, you don't want the dad to like attack you in the office just because he thinks you're telling on him. And again, it's not your job to ask the kid or the dad about what happened. If you think it is abuse, it's not, you know, oh, well, are you sure you didn't hit him? You don't need to say anything like that. You call and then social services will do the investigating. Okay. Let me see. I think most of this, I know you guys have a whole lecture that's about epidemiology and stuff. So I used to talk about it in this PowerPoint, and now I took out like 99% of it because actually on integrated boards, they